Hey everybody, welcome to Dr. Tom's Tips on Tuesdays at 10 in 10. So really appreciate the comments that we've been getting about this. This is fantastic. Dr. Hirsch, it's always a pleasure to see you. The
Rolando,
topic,
it's good to see you too. Hi, Rolando. What's the topic today? What do you want me to
love
talk
you.
about?
So the topic for today is tips for utilizing Isolite and cavities, dental caries. Dr. Hirsch, what tips do you have for our listeners, viewers, clinicians out there around tips for Isolite and caries?
Okay, bread and butter dentistry. It's what we do all day long, every day. It sustains us until the gravy comes in. So this is our bread and this is our butter. Cavities, that's what we do. Oh, 6 classes of cavities. 1, 2, 3, 4, 5, 6, as we all know. Where is it appropriate and when is it appropriate to do an Isolite? Let's just take them class by class. Class 1. It's about as easy as it gets. Number 30. Can't get any easier than that. What I used to do is I'd get the patient on, I'd pick up a handpiece, I'd prep class 1. Would I put a rubber dam in? No, because it was really easy to get to and I knew I could keep it dry. And I'd prep it and I'd fill it. And then when Isolite came along, I started utilizing Isolite because I found that the tip of the day is it makes it easier. It keeps the area isolated. And even when I wouldn't use the Isolite, my assistant would say, well, Dr. Hirsch, aren't you going to use the Isolite? And I said, no, Rita, I don't have to do this. This is going to be quick, fast, and easy. And she looked at me and says, but Doc, it makes my job so much easier. So the tip of the day for class 1 or class 2 or any filling is Isolite will make not only your job easier, but it just makes the assistant's job easier. So that's tip of the day number 1. Class 2. Class 2s are a little bit more difficult than class 1s. You've got the interproximal situation. When you're preparing a class 2, in fact, here, I was doing a class 2 this morning just before I started this whole thing. Guess where it was? Tooth number 1. Class 2 DO on number 1. Okay, that's a little tough to get to back there. And the patient didn't want any anesthetic. She was one of those. So what did I do? Put the Isolite in her mouth, which gave me fabulous isolation, kept her tongue out of the way, and I've got my patient totally reclined, and I'm working indirect in my mirror, and there's water. My assistant now has the ability to spray air on my mirror to keep my mirror clean, and I can actually see what I'm doing back there. And in this particular instance, I was able to access everything because of the shape of her mouth with the Isolite in her mouth. And that was perfect and fine. Sometimes, though, you have to take the Isolite out of the mouth to get to certain areas. For instance, when I went to place the matrix band on, and I was using a circular matrix band, I couldn't get it in the mouth because the things were just kind of in my way. So what did I do? I took the Isolite out of the mouth, I put the matrix band on, I tightened it up, and then I picked the Isolite back up and put it back in the mouth. So tip number 2 is this. Take the Isolite out when it's in your way and put it back in as you need to for isolation. Sometimes when you've got an area you can't access because the handpiece is hitting the Isolite, take it out, finish your prep, and put it back in because it will maintain that dry field for you, which gives you a great composite restoration in this particular instance. You can actually bond in a dry field, so you get great bond strengths. That's tip number 2. Take it out when it's in your way and put it back in as you need to.
And it's mostly because it's really easy to insert.
Oh, yeah. It goes in and out. 3 seconds. 3 seconds it's in. 1 second it's out, and 3 seconds it's in. It's not like, and I'm going to talk about rubber dam in a few minutes, but that's going to be just down the road a little bit. Class 3 restoration, same thing. They're in the front of the mouth. Just makes things nice and easy and access to. But I'm going to get to the harder ones right now. And these are the challenging ones. And these are the ones that you should really use rubber dam on. Class 5s. You've got a subgingival restoration that's class 5. You've got to get that tissue out of the way. You've got to maintain moisture control. So my recommendation for a class 5 filling, use rubber dam. Let's say we're working on tooth number 20 over here. Punch your 8 holes in your rubber dam. Clamp number 2. Get the rubber dam in place. Get your 212 clamp. put your 212 clamp and get the buccal tissue down so you can get to it, and then take some compound and compound that thing into place. We've all done this in dental school a million times. And once you got out of school, I will tell you right now, 83% of you don't do that, won't do that. And you want to know what? I won't do it either. So it's just a pain. It's a pain to do all this stuff. At least that's the way I learned it. Isolation is unparalleled with a rubber dam. God, you could use a gold foil down there. Nobody does those anymore either. Those are antiquated. There's a few that still do them, and God bless you. They're a fabulous restoration. So anyway, on your class 5 restorations, to the 83% that aren't going to utilize a rubber dam or find it to be too much of a problem, put the Isolite in and do your preparation work. Now, here's also what you should do. If you've got tissue up there, you've got to get that tissue out of the way, and you've got to get the area. You can't have any circular fluids coming up. I'll take some retraction cord. I'll put some retraction cord down there. Sometimes I'll double pack it with a 000 cord from, I like Ultranet cord, but you can use anybody's cord. A 000, a 00. I put it in some hemostatic agent, not because it's bleeding, but because it just causes the tissue to pucker. So I like that aspect. If you find, once again, the Isolite's in the way on a class 5 restoration where you're doing let's say number 18 or number 32, take it out, do your drilling that you have to do, and then put it back in so you've got the isolation. So tip number 3 or tip number 4, if you will, when you're doing a class 5 restoration and you're not going to use a rubber dam, the Isolite's a fabulous way to keep this thing nice and dry and isolated, along with some retraction cord. Another thing that we'll do is sometimes if the tissue is really in the way and it's really subgingival, we'll take a laser. We'll just laser off the tissue. That's what we'll do also. So that's our next tip. It just makes it real easy. Now, last tip of the day is we talk about multiple restorations. You know, patient comes in and they want to get a lot of work done, and you're working all 4 quadrants. Yes, you can go in there and you can isolate all 4 quadrants with the rubber dam. But if you're doing that, you're just doing 1 quadrant at a time. So the 5th tip of the day is when you're doing any fillings, any composite restorations, let's say we're doing number 30, let's say we're doing number 4 up here, you can do 30 and 4 at the same time. It just makes your time easier. It makes access easier to those quadrants. So you can do the left side of the right side of your mouth. And then when you're finished with that, take the Isolite out, go to the left side of your mouth. Great isolation and great retraction in multiple quadrants, or multiple teeth in the same quadrant. So multiple quadrants or multiple teeth in the same quadrant. That's the next step. That's how Isolite will help you in those areas too. Any questions on that, Rolando?
No, so let me get this. Number 1, keeps everything nice and dry, so use it. Number 2, if it gets in the way.
Oh, part of number one. Oh. Make your sister's life easier. She's going to love you for it.
That's right. That's right. 2, you can take it out if you need to.
Yep.
Number 3, for those who don't do all of the things associated with putting rubber dam for a class 5, works really well. By the way, rubber dam is awesome. Yeah, and I heard you say that.
Love it.
Yeah, and it's a standard, so this does not replace or displace rubber dam. It's
Absolutely
just
does not replace the rubber dam. Rubber dam is the gold standard for isolation. I love rubber dam, and I do use rubber dam on occasion. I do.
Awesome. In the instances where you're doing multiple cavities or treating multiple teeth, you can use it instead of having to, I think if I understand correctly, replace, and then up, down, right, left. You can do the quadrant at the same time.
You know, if you've got to put a rubber dam on, and then you've got to take the rubber dam off, it's really hard to put it back on again, and you got to cut it and repunch it. And so, if you've got situations where you're going to different areas of the mouth, you got to get that one area done all at the same time. I mean, we've all come to the aspect where we've, given a mandibular injection, placed the rubber dam on, and they're not numb. Now, crimey, now we got to cut the rubber dam off or take the clamp off to get to the access. It's hard. It's just time consuming. And sometimes our schedules don't allow us to do that.
Awesome. Thank you for that. Appreciate it. And here's the thing. our viewers, if you have questions, if this helped, let us know. If it didn't, we need to know that too. Every Tuesday, Dr. Hirsch will sit here, answer questions, and share his 40 plus years of experience in dealing with all of the different issues we face and how Isolite, or tips on using Isolite for that. So if you like this, please share it. If you have questions, send them on and to us.
You know what? Let me address one thing. Do I have like 1 minute?
Yeah, go ahead. Yeah.
Mask mouth. We've had a new concept. I don't know if you've heard about this yet, but we've heard of a new concept called mask mouth, where patients are getting stinky breath and patients are getting caries from wearing a mask. Just in addressing this, I think the important concept here is for your patients that are wearing masks, you should probably prompt them to make sure they're washing that mask all the time, number one. And number two, probably surgical masks are better than the cloth mask, because cloth masks are going to harbor a lot of bacteria, whereas your surgical masks filter it out. So just want to hit that one for a second.
Awesome. Well, appreciate that. Hey, thank you for joining us, everybody. If you have questions, let us know. Please share. Thank you, Dr. Hirsch, for joining us on Tuesdays at 10 for tips, and we'll see you next Tuesday.
Next Tuesday at 10, everybody. See you then.
All right. Have a great one. Be
Tuesday
safe.
at 10. See you then.
All right. See you. Bye.
Bye.